Lecture 2, Week 2, Schizophrenia and Psychopharmacology. Just a quick review. The brain contains the cerebrum, the cerebellum, the brain stem, the limbic system, the spinal cord, and the nerves that control the voluntary acts and neurotransmitters, which we'll talk more about. The cerebrum contains two hemispheres and four lobes. The frontal lobe controls thought, body movement, memories, emotions, and moral behavior. The parietal lobe contains taste, touch, and spatial orientation. The temporal lobe, smell, hearing, memory, and emotional expression. The occipital lobe, language and visual interpretation. The cerebellum is below the cerebrum. It is the center for coordination of movements and postural adjustments. Controls reception and integration of information from all body areas to coordinate movements and posture. The brainstem in the midbrain that controls the motor activity, sleep, consciousness, and awareness. The pons is the primary motor pathway. The medulla oblongata is the vital center for cardiac and respiratory function. And also the brainstem contains the nuclei for cranial nerves 11 through 12. The brainstem also contains the locus coeruleus. This is the norepinephrine producing neurons, which control stress, anxiety, and impulsive behavior. Please copy and paste this into your browser. It's a little scene from Big Bang Theory. I think y'all get a kick out of it, about locus coeruleus. The limbic system is above the brainstem. The thalamus controls activity, sensation, and emotion. The hypothalamus, temperature regulation, appetite control, endocrine function, sexual drive, impulsive behavior. It also controls the hippocampus, where emotional arousal and memory, and amygdala, the emotional arousal and memory. Neurotransmitters play a huge role in psychiatric illness and psychotropic medications, including their actions and side effects. Neurotransmitters have excitatory and inhibitory components. Uh, just so you know, the excitatory, dopamine, norepinephrine, and epinephrine. Inhibitory, the serotonin, and then excitatory and inhibitory are the acetylcholine. And the histamine is a neuromodulator. Question: is the following statement true or false? The cerebellum contains four lobes. False. It's the cerebrum that contains the four lobes. The cerebellum is located below the cerebrum. Nurse's role in research and education. A nurse's role is to ensure all clients and families are well informed and help the families and the clients to determine between facts and hypotheses. Explain if or how new research may affect a client's treatment or prognosis. Be encouraging. Psychopharmacology. Psychotropic drugs, their efficacy, their potency, their half-life, and their approved use for mental illness. Principles of psychopharmacology. What is their effect on their target symptom? Is the dose adequate for the sufficient time? Is the lowest dose effective? Lower doses for older adults. In other words, it takes less medication for older adults. Tapering rather than abrupt cessation to avoid rebound or withdrawal. Follow-up care with your psychiatrist is vital for the success. Simple regimen to increase compliance. Antipsychotic drugs. Neuroleptics, the conventional flurfenazine and Haldol and risperidol. The conventional flurfenazine and Haldol, and then your second generation is your risperidol. The use of antipsychotic drugs are used to treat psychotic symptoms. The mechanism of action is to block the dopamine receptors. Some of the side effects of the psychotics include EPS. The treatment is anticholinergic drugs. And remember, anticholinergic drugs cause dry mouth. Some of the side effects also were pseudoparkinsonian, which is a stooped posture, a mask-like face, and a shuffling gait similar to folks that have Parkinson's. Restlessness, anxiety, and agitation. Also, NMS, neuroleptic malignant syndrome, is a side effect of antipsychotics. Tardive dyskinesia, and anticholinergic effects. Remember, if you have a dry mouth, you also have constipation, urinary retention. Other possible side effects are increased prolactin levels, weight gain, prolonged QT interval, and agranulocytosis. It's imperative that the clients adhere to their medication regimen. Again, you have to taper to get these folks off these meds, or they will have rebound. Again, the side effects: thirst, dry mouth, constipation, and of course sedation. So safety measures have to be implemented. These people have slower reaction times, no alcohol, and for a missed dose, the dose must be given within 4 hours of the usual time, and your clients also need to be followed with periodic CBCs. Question: which of the following drugs would be classified as a conventional antipsychotic? Phalazine. Just to review the antidepressants, uses for major depressive illness, anxiety disorders, bipolar disorders, and psychotic depression. There's 4 groups of antidepressants: the TCAs, the SSRIs, MAIOs, and other ones, including trazodone primarily. The mechanism of action is to interact with neurotransmitters, especially norepinephrine and serotonin. These are the preferred drugs for clients at a high risk for suicide. Again, the side effects of SSRIs: anxiety, agitation, nausea, insomnia, sexual dysfunction, and weight gain. With the TCAs, again, the anticholinergic effects: dry mouth, constipation, also orthostatic hypotension, sedation, weight gain, tachycardia, and sexual dysfunction. Again, this is the primary reason why some clients are not compliant with their medications. MAOIs: daytime sedation, insomnia, weight gain, dry mouth, orthostatic hypotension, sexual dysfunction, hypertensive crisis, when these people on MAOIs eat foods containing tyranamine. Again, other side effects: sedation, headache, loss of appetite, nausea, agitation, insomnia, and priapisant. That's a sustained erection. Interactions: MAOIs and SSRIs can cause a serotonin syndrome, which can uh, manifest as agitation, sweating, fever, tachycardia, hypotension, rigidity, and hyperreflexia. This can lead to coma and death in extreme reactions. Again, serotonin syndrome for MAOIs and SSRIs given together. Client teaching: it's important that the SSRIs are taken first thing in the morning, the TCAs at night. If there's a missed dose, you have up until 8 hours after the missed dose to take it, up until 3 hours from a missed dose with the TCAs. Remember the safety measures and dietary restrictions of taking an MAOI. Please see 2.1 in Vitabec. Mood stabilizing drugs: again, to review: lithium and some anticonvulsants such as Tegretol and Depakote. And these are used to treat bipolar disorders. Mechanism of action for mood stabilizing drugs: normal reuptake of certain neurotransmitters, and then increased level of the gamma aminobutyric acid, believed to be dysfunctional in anxiety disorders. This is specifically for valproic acid. Again, the side effects for lithium: nausea, diarrhea, anorexia, fine hand tremors, polydipsia, polyuria, a metallic taste in your mouth, fatigue, lethargy, weight gain, and acne. Toxicity: severe diarrhea, vomiting, drowsiness, muscle weakness, and lack of coordination. Tegretol and Depakote can cause drowsiness, sedation, dry mouth, and blurred vision. Tegretol can also cause a rash and orthostatic hypotension. Depakote can also cause weight gain, alopecia, that's hair loss, and fine hand tremors. With either Depakote or valproic acid, there needs to be a periodic monitoring of blood levels, and the blood test should be taken 12 hours after the last dose was taken. It's important that these drugs be given with meals and to remember the safety measures. Is the following statement true or false? A client who takes an SSRI with an MAOI is at risk for hypertensive crisis. That's false. It is serotonin syndrome is what that's called. Hypertensive crisis occurs if a client is taking an MAOI and ingests food containing tyranamine. Anti-anxiety drugs: they're used to treat anxiety and anxiety disorders, insomnia, obsessive compulsive disorders, depression, post-traumatic stress disorder, and alcohol withdrawal. And these drugs include benzos and buspar. The mechanism of action is the mediation of GABA, and they're a partial agonist at serotonin receptors. That's the buspar. Side effects of benzos include psychological dependence, CNS depression, hangover effect, and then they develop tolerance. With buspar, side effects are dizziness, sedation, nausea, and headache. Client teaching with uh, anti-anxiety drugs. The safety measures include no alcohol. There's a decreased response time, slower reflexes, possible sedation. Care must be taken when you're driving or at work. Avoid alcohol and avoid abrupt discontinuation. Again, these are meds that need to be tapered. Stimulants including amphetamines, Ritalin, dexedrine. These drugs are used in the treatment of attention deficit hyperactivity disorder in children and adolescents, and residual ADHD in adults and adults with narcolepsy. The mechanism of action causes release of norepinephrine, dopamine, and serotonin presynaptically. There's a direct agonist effect postsynaptically, and it blocks reuptake of neurotransmitters. Side effects of stimulants include anorexia, weight loss, nausea, irritability, growth and weight suppression. It's important that the client takes the meds after meals. They avoid caffeine, sugar, and chocolate, and these meds need to be properly stored out of the reach of children. Antabuse is used for the treatment of alcoholism. The mechanism of action is to inhibit the enzyme involved with alcohol metabolism, and there is an adverse reaction when they ingest alcohol. The side effects are fatigue, drowsiness, halitosis, which is bad breath, tremors, and impotence. Client teaching: avoid alcohol, including any common products that may contain them. These are things like shaving cream, deodorant, and over-the-counter cough preparations. NyQuil. Which of the following drugs would the nurse expect to administer to a client with ADHD? And that's going to be Ritalin. Methylphenidate. There's a more rapid response to antipsychotics for African Americans than whites, and they are at a greater risk of those side effects. There's a slower metabolism of antipsychotics for Asians, so these folks need lower doses to produce the same effects. A lower dose of antidepressants also for Hispanics and whites to achieve desired effects, and lower doses of lithium for Asians and African Americans than whites to produce desired effects. It's important that nurses view chronic mental illness as having remissions and exacerbations, just as chronic physical illnesses do. Nurses need to remain open to new ideas that may lead to future breakthroughs, and they must understand that medication noncompliance is often part of the illness and not a willful misbehavior. Schizophrenia. Its onset may be abrupt, but most clients Develop this condition slowly and gradually and develop signs and symptoms including withdrawal from family and friends, unusual behavior which may include hallucinations, delusions, and disordered thinking, the psychosis, loss of interest in school or work, or neglected hygiene. Many clients have difficulty functioning in the community. Few clients lead independent lives. Some have persistent negative symptoms, including flight of ideas, jumps from one topic to another, a verbal repetition of a single word or phrase, and imitation of movements of another person. Severely impaired thinking, bizarre thoughts, perceptions, emotions, movements, and behaviors. The peak onset for schizophrenia is 15 to 25 years for men and 25 to 30 years for women. Treatments include pharmacological treatments, individual and group therapies, family therapy and education, and social skills and training. Nursing intervention. Safety for both the client and the nurse is priority. Clients' needs are based upon their visual, auditory, and cognitive distortions. To provide care in a non-threatening and non-judgmental manner. Give client plenty of personal space. Provide explanations that are clear. Present and maintain reality by making simple statements like, quote, I have seen no evidence of that. Quote, I don't hear any voices. What are you hearing? Provide reality-based diversions, including playing cards with them, putting puzzles together, listening to music, occupational therapy, or sometimes just sitting and listening to the client. And recognize nonverbal cues. What are their facial expressions? Are they making eye contact? Set boundaries with the client and observe their body movements. Evaluation. Have the symptoms disappeared? Does the client understand the medication regimen? Does the client have functional ability to live in the community? Are there enough resources for the client? Is aftercare adequate? Are the client and family knowledgeable enough about schizophrenia?